Good morning, everybody. I want to thank everybody for coming this morning. I know it's one of those days in the middle of or towards the end of the week, and it is one that makes it very difficult for us to actually have public hearings, but this is a crucial public hearing that we're having today. Before we start, I just want to make a couple of statements that really disappoint me. Last night at about 6 o'clock, I got an email from Department of Social Services saying that they would not, well, let me just tell you what they said. From the first notice of this public hearing received at Department of Social Services, we have been concerned about the potential for the hearing to venture into areas presently the subject of a lawsuit by the Connecticut Association of Healthcare Facilities. As you may know, the lawsuit alleges that the Connecticut system of Medicaid rate setting violates federal law and seeks an injunction forcing the state to change the system. Due to the fact that the plaintiffs have appealed this ruling and that cases continue, we feel it is in the state's best interest not to risk negatively impacting our ability to defend our position in court. Therefore, we respectfully decline the invitation to attend tomorrow's public hearing. I received that last night at 6. And then this morning, Department of Public Health, due to the fact that the lawsuit it's duplicative. The thing that really bothers me in this is that one statement that I emphasized when I said that this could impact our ability to defend our position in court. Their focus is their position. Their focus is not the people of the state of Connecticut. Their focus is not the people who we care for. Their focus is all about them. And that is extremely disappointing to me. We have a large spectrum of things that we work with the Department of Social Services and Department of Public Health. And in any other time, they could feel free to bring their lawyers with them, to have them control what they respond that is going to affect any case. But the respect of coming before the legislature and making a statement and explaining to us how they're caring for the elderly in this crisis in time is something that they are responsible for and obligated to do. Therefore, I want it on record that I'm extremely upset, reprimanding the Department of Social Services and the Department of Public Health for not taking the step forward to come and at least talk with us about the issues. I know that I'm going to ask right away, everybody take their cell phones out and turn them on silence, because I really don't want to hear cell phones. This is really important. We all have vibrate. We all have whatever that other thing is. But, you know, I've been talking to kids for the last couple of days at graduations, and it is probably the most annoying thing to have children do that. But we're adults, so please turn off the cell phones or turn them on vibrate. So with that, I would like to ask any of my colleagues up here, I want to thank them for coming, because this is, you know, not a normal session for us. This is not a time. We are supposed to be in our districts campaigning and talking to you. So I want to thank all of them for coming up here and giving up their time to talk about something that really is important. How are we caring for our elderly in the state of Connecticut? I'd like to offer anybody a comment if they'd like to make a comment. Otherwise, we will move right into the public health. Representative Gentile.
Thank you, Madam Chair. Good morning, everybody. First of all, thank you all very, very much for being here. This is hugely important. I'm speaking from a personal perspective, and that is I have a mother-in-law that is residing in a nursing home. Fortunately, it's not one of the nursing homes that are currently on strike, but I truly understand from the bottom of my heart, from a public health perspective and a public safety perspective, what we're dealing with here, and I want you to know that I look forward to listening to what you have to say, and I would urge both management and labor to please continue the talks and please come to a fast conclusion and compromise. Thank you.
Thank you. So with that, let's start. Just to give you an understanding, the first hour is dedicated to agencies and elected officials. So I will do that, and then we will go to the public hearing itself. So with that, I will ask Senator Fonfara for the first one. Good morning, sir.
Good morning, Madam Chair and members of the Public Health and Human Services Committees. I want to thank you very much for holding this hearing. As the chair said, that it's not our usual time, although it seems like we're in all the time these days. But I thank you for taking time away from other responsibilities, both formally and as a legislator and otherwise in your lives. We do try to have somewhat normal lives when we're not in session. But this is, as you said, a very important circumstance that is going on today in my district. The Park Place facility, which is one of 4 facilities owned and operated by Spectrum Healthcare, is located in the heart of my district, and many of the people that you see behind us I represent as their state senator, and people who have given mightily to the care of the people who are residents, who are patients at this facility. There are folks who have been working there at that facility for 30 years. 30 years. And I've met them, I've talked with them. They care as much for the people who are residents or patients at this facility as anyone who can, in some cases as much, if not more, than relatives do. For many people who are residents at this facility, they are their family. They are their family. They know what their care needs to be, and they do it beyond the call. And I will say that I've had some history with respect to this facility. Following the Greenwood fire, in which there were a tragic loss of life, and Spectrum took over, Spectrum invited me in and asked me to help them with St. Francis Hospital and Hartford Hospital, because they were not getting support from those facilities in terms of individuals who needed to have additional care, not hospitalization any longer, but weren't ready to go home. And hospitals can recommend and can include various facilities on a list of available places to go, and Spectrum was not seeing that at that time, most likely because of the fire. And I went to bat for them. And I asked that Hartford Hospital and St. Francis assist them in trying to rebuild this facility. They made a commitment to the community. They made a commitment to Hartford. And I've since this time, when this strike happened, I've sent a letter to Spectrum reminding them of my support and asking them to come to the table to put these people back to work, the people who care for the folks who have made this, as the commercial runs repeatedly, a 5-star facility. It's not a 5-star facility because of Spectrum. It's a 5-star facility because of the people behind me and others, some who are on the picket line right now as we speak. But we're here today because of the actions that the facility owners have taken to replace workers, as I said, who have given their lives to the people who are patients there in great need of care, and brought in folks who do not know these people. And based on the results of findings of a unannounced inspection that took place back in April, repeated violations involving failure to communicate a facility fire plan, to ensuring that the patient received proper incontinent care, to ensuring that the proper diet was followed, observations of open sores and wounds that were uncared for, not following proper treatment with respect to that, and on and on and on and on, violations repeatedly. This is one unannounced visit, a snapshot in time. And I would ask you, if you had a family member, a loved one, would you want your family member in this facility knowing what this one unannounced visit found? And, you know, the reality is that many of the individuals in this facility are Medicaid patients. Many are Latino, where the language English is not their first language. But most importantly is, we're talking about a private facility, and I've been on that picket line many times, and I can tell you that they have the police department there doing their job as they're required to do. But I stepped over the line a half a foot, and I was told by the guard, step back. This is like a concentration camp. But there are human beings inside that facility who are, you read this report, these are people who have dementia, who have mental incapacitation. Their ability to communicate is minimal, if at all. We have a responsibility. Government has a responsibility when you license a facility and you say you're going to take care of these people and we will pay you for that. Remember, many of these people are on Medicaid, so the state is funding this. And to not have an idea of what's going on in that facility borders, in my opinion, on criminal. Think about if it were yourself or your family member on a day-to-day basis not getting the kind of care, sitting in urine for hours or feces, not getting your proper diet, not being turned over and wounds being cared for. That's not what we're about. Yet this appears to be what is happening, and maybe worse, but we don't know. We don't know. And I'm here to ask these two committees and the leadership of these two committees to use your ability, use your influence, formal and otherwise, to help us find what information there. Apparently have been additional inspections, but we have been unable to obtain that information to find out, in fact, what is going on there. In the meantime, we fear that there may be worse conditions existing there. So I would hope that you would hear the people following me and take whatever actions you can in your roles as the committees of cognizance over public health, and in particular over the lives of these people who cannot speak for themselves. That's what government is about. That's what we're about. It's to speak for those who can't speak for themselves, particularly people who are in the most fragile of conditions in their lives. I thank you again for holding this hearing and giving me and others the opportunity to speak. Thank you.
Thank you. I appreciate the support for the senators and the speakers coming, but we do ask that we do refrain from applause in the public hearings. Thank you. I know you guys are very adamant about making the statement, but it's very important that we follow appropriate protocol. Thank you, sir, for your testimony. Don't go anywhere because there are people that have questions or things. I just want to know, do you know how many patients at the facility in your neighborhood have Medicaid or Medicaid?
I don't. It's a very high percentage. There are roughly 143 patients or residents at the facility, and a very high percentage are Medicaid.
Medicaid. Okay. Thank you. All right. Starting with Senator Prague.
Thank you, Madam Chair. I tell you, Senator, it's appalling what happens to people when they get old and frail. And the people sitting behind you who have provided good care for these people are not allowed into the facility. It seems to me that borders on abuse and neglect. And I think maybe you ought to ask the Attorney General, or the two of us, or all the legislators here ought to ask the Attorney General about what constitutes abuse and neglect under these circumstances. The patients who are in the facility aren't getting the care they need. DSS has refused to come to the hearing. So I think that the people sitting behind you are lucky that they have you, who represents that district, to be here to speak on their behalf, but also to speak on behalf of the lack of care in that facility for those frail elderly people. So let's follow up on this and see.
I think it's a great idea, Senator, and I will follow up. I ask for to join me and others on this committee, Representative Gonzalez, where this facility is located, as well, and others, to ask the Attorney General to intervene. Thank you.
Thank you.
Thank you. Representative Gonzalez.
Thank you, Madam Chair. And sorry that I was late, but I agree with you, Senator John from Farah, because I've been in that picking line also, and that's my area. I live on the other side of the street, and I've been there when patient came out, and staff, they've been on the picking line, shaved them outside. I've been there when patient came out and they said they are hungry. I received a phone call from one of my constituents saying that he got a friend there. It's been 3 months without taking a shower. 3 months. And he said, he's my dear friend, I love him. But he said, the smell is so strong. And like there is a lot of complaints. Like I said, I live in that street, and I feel a little bit, concerned and upset because I helped them recruit seniors for that place. I used to work in a daycare, senior daycare, and I helped to recruit people from to that area, to that facility. I've still received phone calls from members of the family asking where can I place my father, my mother, and after this strike, I can't recommend any people, any people to put the loved ones in that place because it's terrible. And like you say, we have, enough is enough. The seniors, they work all their life, and now it's time for us to take care of them. And also the people, they can defend themselves and they don't know their right. It's time for us to get up in the plate and help these people. So I really agree with you, and I hope that we can resolve this problem as soon as possible. I think that we should get involved.
Madam Chair, if I could respond quickly, Representative Gonzalez makes me think of a reality, a sad reality. We go on the picket line, we go home after that. These folks, that's their home. Again, unless there are those on the outside who can ensure, whether it's the regulators who have chosen not to be here today to hear what the folks behind me are going to testify to, or others like us, to advocate on their behalf and to protect them. The other thing I'd like to say is that Representative Gonzalez and I both, as we said earlier, advocated for Spectrum when they asked us to. It is my intention to send a follow-on letter now, some years later, to Hartford Hospital in St. Francis, asking them to consider the information that has come to light regarding the conditions of the facilities based on the report, and whether or not that advocacy or that recommendation that they currently make regarding patients going home or going to this facility is in the best interest of those patients.
And Senator, I will put my name to that letter too, because I'm really concerned about it. I did send a letter to them, and I'm still today, they haven't responded to that letter. And what really, one of the other things that really bothers me is that they never complain about it's no money, it's economical problems. The money is there because they never complain about, well, the situation like others, they're complaining like, we got problems, money problems. But what they are doing also with the employee is they want to take their rights, and the employees are there day by day. They are not asking for a lot, but these people, they want to take everything. It's like, humiliating, and I think that, like you, Senator, I will be very concerned. I won't recommend anybody to that place ever until, maybe we can resolve. But my name, I'll be honored that I put my name with your letter.
Thank you.
Thank you.
Thank you.
Thank you. Representative Gentile, followed by Representative Cook.
Thank you, Madam Chair. Senator, I would like to thank you for your testimony this morning. Like yourself, I have the dubious distinction of having two of the facilities in my district. And I've visited the picket line, and I am enormously concerned about the abuse and the neglect of our elderly in those two facilities. I've had several constituents. I would definitely be honored to certainly put my name on that letter, and I would urge any of our legislators to please also join in, because if ever there was a case where we should be asking the Attorney General to please give a ruling, this certainly is it.
Thank you very much.
Thank you.
Thank you. And Senator Prague has raised the idea of asking the Attorney General to do an investigation on this, so she actually just left to go call the office. She doesn't sit still long.
No, she doesn't.
I want to grow up and be a Senator Prague. But this definitely rings of abuse and neglect. I mean, we have a very strong case in addressing that, and that's the most important thing that we need to look at. Representative Cook.
Thank you. Thank you, Senator. I, too, have visited one of the facilities, not in my district, but I have several constituents that are employees of the one in Winstead. And it's been a tragic reality that you have had residents that have passed since this strike has occurred. I think one of the things that tore me apart, we have, and not to undermine the abuse and neglect and all of these things, but the employees that have been there not 3 or 4 years. They're lifelong employees, 10, 15, 20, 25 years. And there was a resident of the facility in Winstead who had passed away, who had been there for almost 20 years. And they had held a memorial inside, and they would not let the picketers cross the line to walk in for a memorial service, of which that is their friend. It is not only the person that they cared for, but that is their friend. It is somebody that they've become family members with, and they've nurtured, cared for, and loved as a family member. And I think that shows the shallowness and the cruelty of this strike that we have here, because we've now crossed the line in a totally different direction. We've taken away the care and compassion of what we as humans know and stripped that ability for the workers that have given everything that they have. It's not about big money for them. It's about the residents of which they've taken care of. I've written a letter myself. I would be honored to join you in this fight. I think that it's just, there's no other word around it. It's wrong. It's just wrong in any shape of the word. So thank you very much.
And I couldn't agree more. Your point is well taken, that the workers provide dignity to these residents and patients, and they deserve to be treated with dignity. And they're not being treated that way. Thank you very much.
Thank you. Representative Lesser?
Thank you, Representative Walker. We're holding a hearing today on abuse and neglect, but I just wanted to say that despite that, I think that the residents of Park Place are lucky because they have an advocate like yourself, Senator from Farah, and a whole room full of advocates who are fighting for them and fighting to improve conditions there. I received a telephone call last night from a constituent who works at another nursing home where she's not represented, and she wanted to be here today. She wanted to testify about abuse and neglect in her nursing home, but she couldn't do that because she told me that she felt that if she did so, she could be subject to retaliation, and that she feared for her job if she spoke up for the care of patients under her watch. She's a CNA. And at her nursing home, she says on her floor she is one of 3 CNAs caring for 43 patients. And at that nursing home, patients are, as a result of that, are victims of bed sores. They can't go to the bathroom when they need to, and they have to get up, even though they're not able to do so safely, because there's no one available to care for them. So I wanted to thank you, Senator Farrar, for taking time out of your schedule to fight for your constituents and provide a voice for folks who aren't able to come here and speak up on their own behalf. I also just wanted to add as well that the folks who are supposed to be ensuring safety at the nursing homes in the state of Connecticut are the Department of Social Services and the Department of Public Health, and I am very disappointed not to see them here looking after the care and the safety of our parents and our grandparents.
Thank you.
Thank you. Any other questions or comments from my colleagues here? Thank you, Senator. I'm asking to get some information on the number of patients. There are 435 beds within the facilities, but I'm trying to find out the information on how many are Medicaid. I think that's an interesting area to look into, because what tends to happen when we have a high Medicaid population, we neglect. And we do it on a variety of different ways and means. Yes, sir.
I just say quickly that I am very grateful, and I'm speaking on behalf of the people that I represent, both in that facility and outside of it. Without you being willing to hold this hearing today, we'd continue to have to scrape and scrounge and find ways to get the word out as to what's going on there. We're very grateful to you as a leadership here in this building to take time out to bring light to this even further. We thank you.
Thank you, and thank you for your testimony. Remember, everybody, turn off the cell phones. Off. Vibrate. Senator Crisco is the next speaker. Good morning, sir.
Good morning, Madam Chairman, and thank you so much, and to each and every one of you for holding this hearing. Hubert Humphrey once stated that the true moral test of government is how it serves individuals who are in the dawn of their life, children, who are in the evening of their life, the seniors, and who are in the twilight of their life, the sick, the handicapped, and disadvantaged. And I just believe that we somehow, collectively and individually, have to find a solution to this horrible situation. I speak from experience. Recently, my father, before he passed away, spent a year in a nursing home with 7 amputations due to diabetes, dialysis twice a week, and really was a test of a very strong individual. And those who cared for him, the providers, the individuals, literally became part of our family. And I believe that we should do everything we could to resolve this situation. I personally called the owners of the nursing homes prior to the strike, offered my assistance, but it was never accepted. I visited, we have 2 nursing homes, along like Representative Gentile, one in Derby and one in Ansonia. And it's just a travesty that we can't resolve this situation. Obviously, my personal opinion is that there is perhaps some financial accounting benefit for certain corporations to lose money up to a point, because that way they make money. But, morality, is a test not only for government, but also for employees and employers. And if there's somehow, some way, we could resolve the situation, I'm just willing to contribute. But again, I thank you so much, and I want to avoid redundancy that will probably be repeated. But the issue has crossed the line, and those very frail, the ones that need our help, I believe are in jeopardy. And every day that this goes on, more risk is experienced. So thank you so much. Unless there are any questions.
Thank you, sir, for your testimony. Have you spoken to anybody from Spectrum? Have they reached out to you? Have you talked to them?
No, as I stated, I called before the strike and did speak to one of the owners and offered my assistance. But unfortunately, it wasn't accepted. And so, because knowing the individuals who work in my 2 nursing homes in Derby and Ansonia, what they contribute, I just felt it was, the right thing to do. Not only that, but we'll wait for Senator Prague to finish with you.
Only one senator can say that to the other.
She's like my mother in the caucus room, I have to tell you. But she's beautiful. So we're so close to experiencing, great risks. It shouldn't be this way, and there has to be a resolution to it. And I respect the owners of nursing homes. They do provide a great service, because if they didn't, then government would have to. But at the same time, I believe that the responsibility and morality is not being committed, and we should do everything we possibly could and to help the situation. It isn't easy. But at the same time, when I chaired APROPS, I worked with other corporations in the industry, and we had no problem in talking and resolving issues. And I realize there's a great demand for reimbursements, but and we all try our best. So I again applaud you and ask your continued work and trying to provide resolution to this issue.
Thank you, and I apologize for not acknowledging the fact that you were the chair of the insurance company, and maybe there's something we could, company. I just gave you a CEO position. But maybe there's something that we can look at that we can do for the future in regulations of these situations. I know when I first started here, I listened to a report from Program Review and Investigation, and they talked to us about the number of required hours of contact in a nursing home. And at that time, they were diminishing it then. And I think at the time, I'm sure Senator Prague knows this very well, I think it's right now, it's 1.7 hours a day of actual contact for a person in a 1.9? It went up. It was 7.5 at 1.27. But just think about the fact that someone is sitting in their room, and the problems that happen when you don't have them change when they sit in their own urine or feces. UTIs or urinary tract infections are something that are so common over and over again for this population because we do not require them to be addressed and cared for. I think we have to look at some of those things. So thank you very much for testifying, sir. And yes?
No, go ahead.
No.
Well, thank you. The pay as chairman of insurance is not as good as the CEO of the insurance company.
Trust us, we all know that.
But working together with the Public Health Committee and the Human Services and Insurance Committee, I'm hoping that we could come up with a solution. As I said, again, being redundant and quoting Hubert Humphrey, there is a true test of morality for government and how we serve these individuals, and it's so crucial. And through our own family experience, and I know all of you have had some experience whatsoever, it's just something that has to be corrected.
Thank you.
And we appreciate all your work. Thank you.
Any comments or questions from my colleagues? Senator Prague.
Senator Crisco, I know how sensitive you are to the needs of people. The nursing home industry is a different kind of business than regular businesses. When they decide to go into the business of caring for the frail elderly, their bottom line cannot be the almighty dollar. It has to be the quality of care that they provide for these people that they are committed to care for. They have to make a reasonable profit, but the first priority when you go into this business, and you know it, is that you are responsible for the care of these people. We had a bill last year that would hold owners of nursing homes responsible if there is abuse and neglect in their facilities. It was a bill that became part of the public health licensing procedure, that when they come in, when any owner comes in to get a license to operate a facility, they have to be told in big black and white letters, and you know those big black and white letters, how we put them on important pieces of information, that they will be held responsible for abuse and neglect of patients in their facilities. And when they sign that bottom line, they legally assume that responsibility. That bill passed the Senate, but not the House. It will come up again next year. But let me tell you something. There is no defense, in my opinion, for this corporation.
Yes, ma'am.
When they can do what they're doing to people, as you have said, the moral test of government is how it takes care of those in the dawn of life, the children, those at the twilight of life, the seniors, and all those in between who are sick and poor. This is such a serious issue. I'm very happy to see you here testifying on behalf of the workers and on behalf of those elderly people who'd have to depend on other people for the quality of their lives. Thank you very much.
No, thank you, Senator. Yeah, we appreciate that, and we agree with it. And not only are we working here on the state level, but we've also worked with local governments, particularly in the city of Ansonia. We testified in regards to an ordinance that they passed recently in regards to the striking situation, and I believe that there's a hearing next week in Derby too. What will happen there is too difficult to say. But again, thank you very much.
Thank you.
Thank you.
Any other questions or comments? Thank you, sir, for your testimony. Next, we have Deborah Chernoff from 1199. Good morning.
Good morning. Before I start my testimony, I do have the answer to your question about the Medicaid percentages. I will get them to you in writing, but if I remember correctly, on the last cost report, Park Place was 83% Medicaid. Okay. And the statewide average is about 67, 68%, so that's a significant factor.
Thank you.
My name is Deborah Chernoff. I serve as the Communications Director for District 1199, and we represent 22,000 healthcare workers, including the 400 nursing home workers who are currently engaged in the strike against Spectrum. Today is the 70th, 70, day of that strike. There are many other family members and residents themselves who would have liked to be here today to tell you more about their concerns, but their circumstances didn't permit that. But their stories are available to you in a booklet you may have seen. I have more copies of that if you need it, on the Spectrum Family Voice website and via our public information TV campaign. Although the outlier posture assumed by this particular employer, Spectrum, is unique, the strike doesn't happen in a vacuum. And you've heard me testify, unfortunately, on these issues many, many, many times before. Caregivers, residents, and families all say the number one barrier to quality care in nursing homes is staffing. And Senator Prague probably knows that better than anybody else in this room. The case for better staffing has long been proven in research literature, but the public health code on staffing levels has not been adjusted for decades. That 1.9 hours of care per day has been around for a good 25 years, back when nursing homes were old age or rest homes, not the chronic care hospitals they have become today. Our Medicaid reimbursement system, too, is broken. There's no correspondence between the actual cost of care and Medicaid rates. Even the periodic rebasing of rates was suspended in the last budget cycle, and the savings that we get now by cuts or by budgetary gimmicks become costs that are paid by residents and caregivers. Today there are 5 nursing homes which remain in bankruptcy. Over the last year, Another 4 homes have closed, and a 5th, Cortland Gardens in Stamford, has just filed for a certificate of need to close, despite a huge outpouring of outrage from residents, family, staff, and the Stamford community who are passionate in their support for the high-quality care that our members deliver there every day. The urban center nursing homes, as you pointed out, Representative Walker, are in particular distress because most, if not all, of their residents must rely on Medicaid to pay for their care. And we know that on average, Medicaid providers lose at least $12 a day, often much more, for every Medicaid resident. Residents and families are traumatized by the loss of care and community these closures represent, and for every bed that we lose at least 1, if not many more jobs. Let me just wrap up by saying this. You have my written testimony. None of these factors that I've mentioned, the disincentives to investing in better care, the problems with staffing levels, none of them excuse Spectrum Healthcare's behavior in violating labor law, in refusing to settle on the same general terms as 36 other nursing homes, and the disruption that is to resident care that the strike is causing is going to continue indefinitely because Spectrum has asserted, and the Labor Board and the Department of Labor has agreed that these workers have been permanently replaced. That in itself, no matter what else we're talking about, is a huge barrier to ever resolving these issues. Other nursing home operators facing the same difficult conditions have acted responsibly and settled modest but fair contracts. This is the only nursing home that hasn't, and this is the only nursing home to have a strike. I'm urging you also to take a look at the broader context, because if we don't understand the factors that create the atmosphere in which these things can happen, we're going to march down this path time and time again. And unfortunately, for all that we suffer and the community suffer, it's the residents themselves, as you're going to hear, who are going to bear the brunt of our collective failure. Thank you for your time.
Thank you for your testimony. Can you just give me, with your attached testimony, you also gave us a letter that outlined some of the violations that were in the nursing homes, Spectrum's nursing homes. Can you give me just a quick summary of some of the things?
Sure. What I attached is from just the first 2 weeks of the strike and just at Park Place. There's a considerable time lag between the time that DPH does its inspections and writes up its violations report and the time you can actually get your hands on them as public documents. But in the first 2 weeks of the strike at Park Place, they found 39 violations of the public health code. And some of the kinds of violations are people getting their medication hours and hours late, getting the wrong medication, getting meals not on time, getting the wrong diet, not getting proper care for pressure ulcers, not following the care plan. And this is a particular issue at Park Place, and I'll remind you of why. The replacement workers not being familiar with the fire plan. Now, why is that a big issue at Park Place? Because Park Place used to be called Greenwood before Spectrum bought it, and if you remember, in 2003 there was a tragic fire there. 16 people lost their lives. And as a result of that tragedy, we were able to find the funding somehow to retrofit the older nursing homes in this state with sprinkler systems, which Park Place or Greenwood at that time didn't have. Many of the people in this room were there during the fire. They helped carry people out if they were on duty. Their lives were at risk. But unfortunately, all too often in this state, we make our public policy based on after something tragic has happened, after the bridge collapses or the people die in the fire, and not before that point. And I'm hoping that we're not at that point today.
Thank you. Senator Craig?
Deborah, I know there's a lot of complaints about the way we reimburse nursing homes. Can you tell us how Medicare pays for patient care? Don't they group their patients by the acuity of the illness or something?
They do. Medicare, it's not by no means a perfect system, but one of the issues with Medicaid is that it's a flat daily rate, whatever DSS sets it at, which doesn't have very much anything to do with how much care a particular resident needs. With Medicare rates, which again are for short-term or rehabilitation, it's ostensibly set anyway by the severity of the diagnosis and the need for treatment. So you have Medicaid residents who may require a feeding tube or a respirator, or who are what we call total care. They really can't do anything for themselves. And if you have a high preponderance of those residents in a nursing home, that nursing home is facing a considerable strain, and if you can't get the money from DSS, then you try to get it from the workers by trying to slash their wages or by cutting their hours, or the layoffs, which we've all seen happen in the last couple of years. That's accelerated, and that has worsened the staffing crisis.
Do you think if the state adopted a Medicare system of reimbursement that we'd have more stability in our nursing home system?
There are pluses and minuses to that kind of acuity-based reimbursement. I do know that when Program Review did a study back in 2000, a report issued in 2001, they had a different approach, which we think is worth taking a look at, and that approach has to do with a higher rate of reimbursement for homes based on how many Medicaid residents they have, and so that those urban nursing homes, it somewhat parallel to the kind of dish payments that we give to acute care hospitals, so that those urban nursing homes in particular that are dealing with a very high Medicaid population would not suffer the same kinds of issues. And so we don't have some of the large facilities that are under considerable strain today caring for the people who have the most problems and the fewest resources and are at the most risk of being booted out of their residence because the nursing home goes under.
Thank you.
Thank you, Senator.
Thank you. Any other comments? Representative Gentile.
Thank you, Madam Chair. Deborah, thank you for your testimony and providing us with documentation. I'm just curious, do you know if there have been any violations at the two facilities, one that is in Ansonia and one that is in Derby?
There have been some. One of the problems is that this was really the only typed document that we were able to get a copy of. There are a number of violations, but they're basically the field report, so they're scrawled in people's illegible handwriting. And as those documents become available, we will make sure that you get copies of them.
I would appreciate that. Thank you.
But there is a time lag, as I mentioned before.
Thank you.
Thank you. Any other comments or questions? Thank you, Deborah, for your dedication. Thank you for also your research. And I think we need to open this back up. It was 2000 that we did the program review investigation, and it is outdated. And that time there were still, I think there were about 20 different counts in there of things that we could have addressed, which we didn't. We didn't even seem to go further into. So I think we need to bring that back, and hopefully we'll get an administration that's committed to improving the quality of life for our seniors in the state. So thank you very much for your testimony.
That's something that we can all wish for, and thank you for this opportunity.
Yes, thank you. Next, we have Maria Parks. Good morning, ma'am.
Good morning. How are you?
Thank you for testifying. Could you state your name?
My name is Maria Parks. I am an LPN at Park Place Health Center. I have worked there 25 years in many different capacities. I have worked all 3 different shifts. I have worked as a charge nurse, a treatment nurse, a unit coordinator. But today I'm here as a family member. My fiance's mother is a resident at Park Place. And the reason we chose to place her there was because I work there. And I know that all of us that work there give excellent care. I have excellent coworkers. We give excellent care, and I felt very comfortable in placing her there. And there was no question that that's where she would go, so that she could see me on a daily basis. I could keep up with what was going on with her, and I felt comfortable in knowing that she would get the best care at Park Place. But since we've been out on strike, I have many, many concerns as far as the quality of care, the concern of the people that they have hired to replace us. The first time we visited her after being out on strike, we asked her, "How are you doing?" She told us she had not been gotten out of bed in 3 days. And she was gotten out of bed every day prior to that. When I went to the desk to complain, the director of nurses basically called me a liar and said that, well, you know she doesn't remember, she doesn't tell the truth. And yes, she is a little forgetful. She does not have dementia, but this woman knows when she's left in bed for 3 days. Other conditions, every single time we visit, she is in bed. I have gotten her out of bed myself when we go visit. She is never fully dressed. She is in a Johnny coat with a shirt. She has no pants on, no socks, nothing underneath, and she's basically in bed. I have gotten her up myself numerous times. Sometimes she says she's tired. I leave her in bed. But I'm concerned about bed sores. She has a previous history of a leg clot. I'm concerned about her developing, further clots. I'm concerned about her developing pneumonia. She's a very poor eater because she is on a special diet, thickened liquids, and she doesn't like to drink. The first day we went, she asked for 3 glasses of ice cold water. And it made me think, was she given anything to drink that day? And I really am concerned. She has not had a shower since we've been out on strike. I called the facility one day because we took her out. Her hair was sticky and matted, and she was dressed in sweatpants and a sweat top in a 90-degree day to take out. It was awful. She was in a wheelchair, and I had to bring her back to the nursing home after only 2 hours because she was so uncomfortable. She was having severe lower back pain, and she was complaining of burning when she went to the bathroom. I had to ask these questions of her. I had to go in there when I took her back and tell the nurse, please follow up. Please give her something for pain. Please have her checked for a urinary tract infection. Please take care of these things. And only several days later, because we kept calling and inquiring, did they obtain a urine specimen and sent it out to the lab. And almost 10 days later, did she finally get treated. I mean, it's awful, and I'm here to ask for whatever help we can get, because those residents need us to go back in there to give them quality care. They're not being asked if they're in pain, they're not being asked if they're okay, and they're not being taken care of.
Thank you for your comments. Senator Prague?
I would ask you to document this stuff.
I certainly
Document it so in case it's needed, we'll be able to get it from you.
Oh, absolutely. I could do it.
It really is a terrible thing.
It is, and I feel bad because it was my decision, having worked at Park Place, working there, to place her there. So the guilt I feel, not having her being taken care of, I feel terrible. It's a terrible feeling to know that we're not there taking care of her properly, and I'm the one that, basically convinced my fiancé to put her there because of the excellent care we were providing before the strike.
Well, it's not your fault.
Well, I know.
I know.
But
it's easy for me to say that.
It doesn't help when you have a loved one being neglected.
How many beds are in that facility? Do you know?
I'm sorry,
How many beds are in that facility?
I believe it's like 150, it may be less.
So it is the larger facility
Yes,
of all
it
the
is.
others?
Yes.
It's 150, okay. All right. I want to echo what Senator Craig said. You need to document this, please, for all the incidents that you notice, and be pretty thorough about what's going on. One of the things that we could look into very carefully, and very quickly probably, is the number of patients that have actually been experiencing UTIs since that. I mean, that's a very clear indicator, number one, of them sitting in their urine. And then there are a few other things that we can actually call on the Department of...
Her son has been following up with the Department of Health. He's made several phone calls. He's emailed them. He is pursuing these issues that I have presented to all of you, but
it would have been
it's
good
a
to
slow
have
process.
them to testify today in front of us, so we could have asked them the questions.
I have asked him to.
And I think the thing that really is more horrific is the fact that they did not come today to talk to us and tell us what their findings are. It has nothing to do with the suit. It has to do with the care of the residents in the facility, and they have to be responsible for that. So, thank you. Any other comments, questions? Thank you, and please make sure you keep that documentation.
I will.
Thank you.
Thank you very much.
The next one is Kim Wilder? Kim? I'm a butcher on names, so I hope she can clarify to me what the names, how to say your name properly. Okay, we'll move on to the next person. Patty Pickus.
Good morning, good afternoon.
Good afternoon, ma'am.
Okay. My name is Patty Pickus. I'm an LPN at Park Place Health Center. I've worked there for 21 years. Good afternoon. I stand before you today requesting that you address the strikes at Spectrum Health Center. Since walking the picket line on April 15th to present, I hear the struggles of the residents and families at Park Place Health Center daily. I hear about the day-to-day living the residents are succumbed to. A resident asks his nurse at the end of the shift as to where his meds are and is told, "Oh, you have meds?" Another resident, fearful to take meds from his nurse because they've been someone else's twice, is told he's a behavior problem. Another resident, as he leaves the building for dialysis, is complaining that he's not receiving his meds on time before he goes, and as he's leaving, a co-resident runs his lunch out to him. Many residents and families are complaining of the cleanliness of the facility, as well as many of them are complaining that the laundry is being delivered to the wrong resident or not at all. A family member who has always visited other residents just to keep them company because they either had no one or wanted the company was told she may not visit anyone but her brother because she complains too much. A family member requests mashed potatoes for her mom and is told there are none. Another family member who complained that her dad had been sent the night before to the ER because his fingerstick blood sugar was 40, which was clinically below the norm, and he had complained that he wasn't feeling right and told the nurse. A glass of orange juice or maybe even glucose tube would have resolved that issue. Another resident who on many occasions has come to the picket line to receive proper care, a shave, had stockings not applied properly. Another resident who saw the owner in the building for a cookout for replacement workers states, "I just wish he could get someone to properly book my transportation. I've missed my appointment twice." Another resident who has frequent urinary tract infections, family has complained to the nursing staff of the issue. After several days, the specimen was gotten sent and later treated. Yesterday on the picket line, one of our residents one of our residents complained of shortness of breath and was sent out 911. while most of the replacement workers were standing on the side of the building. My saddest incident was the young man, loved by us all, who missed us all because he knew we loved and understood him. He passed in the night as we all walked the picket line. We know our residents, housekeeping, porters, laundry, nursing assistants, and LPNs. We know their needs. We're their extended family. We give the quality care. We give the five-star care that is no longer there. Please, I ask you to take it as your responsibility to make these wrongs rights. Help the people in the middle, the residents. Tell Spectrum owners it's time to stand up for the quality of care at their homes, for the residents and their families. Tell Spectrum owners to end the strike now. And as I look before me, I see many familiar faces, and I thank you for your support.
Hey, don't go anywhere. Don't, sit back, sit.
That's not enough.
It's not that hard to testify. We're just having a little conversation, just you and a few of our friends in here. Thank you, first of all, for your testimony. I was just told something that I just sent her Prague because she's so good at getting people to respond. Our elder abuse unit has been without representation since November of 2009. We have no one that is filling that position in the state, which is sort of sad. So nobody, but we do have, and the irony is we do have someone who works in the Medicaid fraud unit. So it's not about the care for our clients in the nursing homes, it's about how much the dollars are. It's kind of bottom line. Thank you for your testimony, and thank you for being committed to improving the quality of life for so many people. Any comments or questions? Yes. Representative Arasimuns.
A to Z works fine too. I just want to thank you for testifying. It actually brought me back to a time in my life. I got out of the military, and I was a CNA in a nursing home. And what you said for all on this committee is exactly true. On the ride up, knowing I was going to be here, I was thinking back to it, and I remembered every single one of my patients' names. I had them every day. I showered them, fed them, dressed them. And you said extended family. And they were family. I remember, they'd get upset. Things would happen. They would start realizing that they're not well, and you'd sit, you'd talk to them. You were a counselor, you were a family man. So that is a big difference, and it really saddens me to hear, you could guess it was going to happen. These are replacement workers or pool nurses or whatever they can find, just brought in there to get paid and do a job and get out of there. So on behalf of this committee and everybody up here, we do care. We truly do understand that you are the family members and you are the folks that rightfully need to be caring for those residents. And everything you said just struck a chord with me. So thank you for everything that you do, and everybody in this room, thank you for what you do. You do make a difference, and we do understand how important you are. And at least on my behalf, I'm going to do everything I can do to ensure that you get back in there to provide the patients, residents, with the quality care they deserve. So thank you.
Thank you.
Thank you. Any other comments or questions? Yes, that again, we ask you to give us documentation on what you've seen and what you've been doing. Okay. Thank you so much.
Thank you.
Stephen Magro. Good afternoon, sir.
Good afternoon. Thank you. My name is Stephen Magro, and I'm the research analyst for District 1199 New England. I'm here to testify about our research into the health and safety records of Spectrum Healthcare's nursing homes in Connecticut. Over the years, we've heard from workers at these facilities about high rates of injury and inadequate health and safety policies. Our concerns were heightened when we learned earlier this year that 5 of Spectrum's 6 Connecticut nursing homes had received letters from OSHA notifying them that they are among those workers who suffer rates of workplace illnesses and injury that are over twice the national average for similar workplaces. These 5 homes, which include all of the 4 homes on strike, are repeat offenders, having received these notices for at least the past 5 years. In fact, this last year, Spectrum has a higher percentage of its homes in receipt of these letters than any nursing home company of any significant size operating in our state. According to Assistant Secretary of Labor for OSHA, Dr. David Michaels, receipt of this letter means that workers in that particular establishment are being injured at a higher rate than in most businesses of its kind in the country. Employers whose businesses have injury and illness rates this high need to take immediate steps to protect their workers. What we've experienced dealing with Spectrum has only reinforced the impression of a company that feels it is above the law and will only comply with the law if forced to, and even then only at or after the last possible minute. When we surveyed our members about health and safety practices, they described a host of problems, including reports of inadequate training on hazardous chemicals, including training in which employees who were quizzed on policies were given the answers by the employer. We were told of inadequate training on the handling of bloodborne pathogens and chronic problems with leaks and slippery floors. In order to compare our information with concrete data generated within these institutions, we made routine requests for records from Spectrum Healthcare. These requests were for injury records that Spectrum is required to provide to us by law. Time after time, information that was provided was late or incomplete. To cite just one example, we requested individual injury records from Spectrum on February 5th of this year. According to the law, Spectrum has 7 days to provide them to union representatives. We just received them last week after over 4 months. Had we not complained to OSHA, which wrote strongly worded letters threatening inspections, I have no doubt we would still be waiting. We're concerned about the health and safety of our members, as well as the health and safety of those who are currently working in the facility. And we know that in healthcare, when worker safety is compromised, patient safety is also compromised. We're going to be following up our concerns by filing formal notices of alleged health and safety violations with OSHA, but we can't just depend on one government agency to settle this problem. That's one reason why we're here today, to share this important public safety information with you. It's our joint responsibility to address these issues to protect workers and patients alike. Thank you.
Thank you for your testimony. Any questions? Senator Craig?
Thank you for your testimony. Does OSHA have the power to shut a facility like this down when there are so many safety violations?
OSHA has the power to issue health and safety. It has the power to issue health and safety violations, and it certainly has a great deal of authority. We want to see them exercise it to the fullest here. We've had some movement from them. They actually entered the facilities to obtain documents from them. That was after they were several months in arrears. That's a first step. What we would really like to see happen is for OSHA to inspect these facilities fully to ensure the safety of everyone involved and to make sure that things improve there. This is not simply for patients and workers, but it's also for the good of the company themselves. So when a company tries to evade this, it's a serious problem for all involved.
Can this committee help you in any way push OSHA to do what they should be doing?
Yeah, any contact with the OSHA offices in Hartford and Bridgeport would be appreciated. They are, as I said, they have entered these facilities to obtain these documents for us. We are concerned. That's a first step so that we can compare our data to their data and to see where there are discrepancies, where they are aligned. But any greater steps that can be taken to sanction this company for violating health and safety standards, or to get them to change or sort of align their policies would be appreciated.
Well, I think we need to be in touch after the hearing. Representative Walker and other members of the Human Services Committee, and I'm the co-chair of the Labor Committee, so perhaps we could help you. You direct us as to what you want us to do, what kind of a letter you want us to send. The safety of the workers is equally as important as the safety of the patients. So thank you for coming today.
Thank you.
This facility is really something else. I mean,
yeah.
Man alive.
Representative Lesser, followed by Representative Gonzalez, followed by Representative Thompson.
Thank you, Madam Chair. And thank you, Mr. Magro, for your testimony. We have here before us some testimony submitted by the Connecticut Association of Healthcare Facilities, which is the trade association that represents Spectrum. And I honestly don't know if they're planning on testifying in person here today. I don't believe that they are at the moment, but I did have some questions for you on their testimony. They said on the second page, they said that all Connecticut nursing homes engage in rigorous strike contingency planning with state officials. The plan must be approved by the Department of Public Health. Every nursing home has a plan in place to ensure that high-quality staffing will be in place to care for residents. And they say that, they go on, they say that Connecticut nursing homes have a strong history of assuring for quality when it has been needed and are very experienced and well prepared in the event of potential strikes. So I guess my question there is, in describing the run-up to this, do you feel that the planning was sufficient with the Department of Public Health, and was the union or were the workers at the at Spectrum consulted in how to best ensure continuity and quality of care?
Thank you. We actually filed a Freedom of Information request for the strike contingency plans that are filed with the Department of Public Health. We were told that they would not be released to us. So we have tried to get that information, but it wasn't given to us. So I can't evaluate the quality of their strike contingency plan.
And I guess my follow-up question would simply be, is the current process sufficient? Could the law be changed? Could this joint committee assist in any way in improving the planning process to make it more collaborative, to ensure that we're looking out for our parents and grandparents?
Certainly. I mean, I think there could be greater transparency. I think it would be helpful if these plans, or at least some portion of them, were a matter of public record, so we could all evaluate just how well in place these plans are, so that we don't have the kinds of problems that we're hearing about.
Okay. Thank you.
Oops, thank you. Representative Gonzalez.
Thank you, and thank you for coming. Do you have any information about the people that they hired, if they are qualified to provide care to the patients? You don't?
They are supposed to check. I mean, it's the responsibility of the home, I believe, to verify their licenses. They have to ensure that CNAs are properly licensed.
But you don't know if they are going by that.
I can't be certain. No.
Okay, and what about the state health department? Because you was asking about, if we complain, to who we can complain, to OSHA, and my question is, what about the State Department? We can complain to them, and I think they can take a look into, the security, the safety, and the care provided to the patient. They can close the place.
Well, from the Department of Health, we would like to have documents. We would like to get documents in a timely manner. And and we would like to see consistency across the various homes in terms of the way that documents are laid out, and we would like to see things more rapidly and more more aggressive inspections.
Okay, thank you.
Thank you, Representative Thompson.
Good afternoon. I'm sitting here going back about 30 years when I was representing an employee of a mental retardation institution who had been fired for neglect of duty leading to the death of a child. And every employee above that employee, up to the building supervisor, was suspended for various time periods. We had requested the Personnel Appeal Board hold its hearing at the site of the incident, and the chairman of the board, a very prominent attorney in Connecticut at the time, ruled that they would go out to the institution and hear the case. And as the case turned out, the aide was an older woman. She had been not very much experience in the field, but had been working there for a while. And she was, at the time of the incident, was in a building, and she had a unit which consisted of a recreation and living area, I guess, bathroom and shower, and a sleeping area. And there were residents in each one of those areas at the time when food was being served. And they had at that time educable and trainable youngsters who assisted the aides in their chores. But she was one employee in this facility and had to be in 3 places at the same time. One of the children had to be fed. She was restrained during the day and in a crib, if I remember correctly, with a net over it during the night. She was a danger to herself and to others. So one of the residents who was helping out loosened up a restraint. The restraint got into her mouth, and the child's mouth, and she choked and died. And the response to that was to dismiss this employee for negligence and to suspend everyone above that employee in that particular building, including the nursing supervisor. I think there were 6 or 7 employees. None of them appealed. This woman appealed. And it went to a hearing. And on the day of the hearing, the chairman and the board reversed the decision, reinstated the woman, gave her full back pay, and so on. The child was dead. It seems to me what we're hearing here is now stories that are very similar to that story. So we're not playing games here, we're playing with people's lives. And it would seem to me further that that case, and among others, was one of the reasons, or perhaps the primary reason, not just that single case, but that type of situation, why the whole field of mental retardation and mental health and so on in our institutional care just took on a life of its own. We closed many of those facilities. We found a better way of, we returned people to the community and so on and so forth. But it was so outrageous, I believe, that it spurred reform. And the stories we're hearing here today, it seems to me, need that type of reform. So I don't know why we need very much more evidence if the stories are all going to be the same. And compelling as they are, it would seem to me that this committee, for example, might take responsible action by doing what Senator Prague was doing, contacting the Attorney General's office to inquire immediately and have this situation looked at from the outside before somebody really gets hurt. So Madam Chair, I speak from that experience, and I don't know whether everybody else has the uncomfortable feeling that we're hearing a lot of testimony when people should be acting on what we're hearing about. So I would feel very strongly that the action of the committee just referring this and going on might be wasting a lot of valuable time. It's very clear that nursing home industry is a lot different from what it had been in the past. And there's a move to move people out of nursing home facilities and put them into smaller facilities and so on and so forth. Well, that may be one of the answers, but certainly better control over a situation so that the public knows and realizes what you're telling us here today is that people are in danger, incidence of injuries to the employees is up, and so on. It seems to me it's out of control. And we should, rather than wait for somebody to do something, we should take action here in this committee and say, let's get on with the show. We'll talk to the Attorney General, and we'll talk to the Governor, and we'll get some light shed on this situation. It's too dangerous. been involved with something where a similar situation led to the death of a child, and there were other deaths at that time, and there were other abuses and so on. And finally, you know, we got wise and we did something about it. Well, it's still, it seems to me incredible that we would continue to hear this, and apparently you folks have been working at it for a time. You went on strike and everything else, and there should be some lights, much brighter light shown on this, and maybe this is the opportunity to do something about it, and I think we ought to do about it. So I will move that we as a committee take action in support of the request that has been brought to us at this public hearing. We are very concerned about it. We should do something about it immediately. That's a motion.
I'll second it.
Thank you.
Thank you, and Representative Thompson, thank you for your comments and your. What's with that seat? Just to give you a little follow-up information, we found out that Chris Skadalis is the director of Medicaid fraud and he's out of the prosecutor's office. So we have gotten in contact with him. I'm telling you, Senator Prague is the person you want on your team. We've gotten in contact with him, and we are setting up a meeting for next week, early in the week, to sit down and talk with him. And we'll see if we can get public health to at least come and talk to us behind closed doors and give us a little bit more detail about what's going on. So if you have some things that you want us to look into specifically, it would be very good if you could get it to either Senator Prague, Representative Abercrombie, or myself.
Thank you.
Thank you, and thank you for your testimony, sir.
Thank you very much.
Thanks. Any other questions, comments? Thank you. Next we have Sue, I don't know. Sue Dar, I think that's D-A-R-G, Dargis. Okay, it's very interesting. Yes, Representative Thompson.
I made a motion. If I was out of order making that motion at this time, I will withdraw the motion and hope that we will act on it when we're in discussion.
Sir.
I said I made a motion, and if I was out of order in making the motion during the public hearing part of it, I will withdraw the motion if my seconder will withdraw her second, and I would request that it be taken up when it is appropriate to take up that action.
Thank you. Senator Prague?
I'll withdraw the second.
Thank you, Representative Thompson. This is a public hearing, so that's a good point. Thank you, sir. Turn off your microphone, sir. Okay, please. Yes, ma'am. Could you state your name, please?
Good afternoon. My name is Sue Dargwitz, and I'm a CNA for 13 years at Birmingham Healthcare. You know, there's a saying, do what you love and love what you do. And I, along with everyone else in this room, really love taking care of our residents. That's why when I'm on the picket line and I hear sirens and see an ambulance and the paramedics, I'm concerned. From our picket line, we can see who's being taken to the hospital. At one point, we visited 4 residents in one day who had been admitted. One resident that really upset us, and we were appalled to see how much had changed in 5 weeks. She was severely dehydrated, had dangerously low blood pressure, and was so much more contracted than we had last cared for her. Her daughter was very grateful that we had been going to the hospital to visit her. And when we visit other residents in the hospital, they're really happy to see us. Every day we hear horror stories from family members as they pass through our picket line. From, they put my father back to bed in the wrong bed, and I'm worried that he might have gotten the wrong meds, to, you know what my mom had for lunch today? A hot dog bun with 1 slice of bologna. That was it. But the main thing we hear over and over again is, when are you guys coming back in? We miss you and we need you, but we support what you're doing 100%.
Thank you for your testimony. A hot dog bun and a piece of bologna.
That was it. No condiments, nothing else to go with it. Probably a drink of something.
Senator Prague?
Thank you, Madam Chairman. First of all, would you give your testimony to Representative Walker? We're going to have a meeting next week early next week with this gentleman that Representative Walker told you about, who's and stuff like that's very important for us to have in discussion. And any of the other testimony that folks have given, if you give it to Representative Walker so we'll have it to show him what's going on in this facility, it would be very important. I have to apologize. I have to be down in Sprague at 1:30, so I have to leave. But any testimony that's already been given or will be given, you know, if you give it to the chair of this committee, Representative Walker, we can use it next week to document what has been going on here in abuse and neglect of these patients.
You know, another thing is that many of the stories we get from families, they're afraid to say something inside because they don't want retaliation against their family members.
Outrageous. Outrageous. Anyhow, so if you would do that, that would be great.
Thank you, Senator Frank. Any other comments? Representative Gentile.
Hi, Sue. Good to see you.
Hi. Nice to see you.
Thanks for your testimony. I would just like to strongly urge you to make sure that you do present your testimony, so we will have it available for that meeting. And also, if you could get testimony documenting these types of atrocities from the family members, it would be very helpful for us. I know they're concerned about retaliation, but if you can get them to submit something, it would be very helpful. So I would urge you to try to do that.
Okay.
Thank you.
Thank you. And if people are afraid of retaliation, I don't normally like this, but if they have to, you can leave their names out, but just give us incidents that we can sort of draw to. I prefer names because it just makes it a little bit more honest. It's kind of like a sniper at night. But if they can't do it, just getting some incidents so that we can start to identify and things that we need to look at, and maybe we need to make some spot visits at some of these facilities. So thank you for your testimony. Thank you, and have a good day. Sue Abbott. Good afternoon, ma'am.
Hi.
Please state your name.
My name is.
Could you pull the microphone closer to you? There you go.
My name is Susan Abbott, and I am a CNA at Laurel Hill Healthcare in Winsted, and I've been there just shy of 20 years, and have enjoyed working there, and have been sorry to see deterioration since Spectrum has moved in and taken over. However, I am pleased to have the opportunity to speak on behalf of some family members. As we've heard already, terrible reports, and at Laurel Hill we've had similar incidents as well. One woman saw that her father wasn't getting shaved. Her mother never had her dentures taken out and cleaned, so she took them home and cleaned them, and has come in repeatedly to care for her parents because the care was not being provided by the workers that are in there since April 15th. We have one family member that bought her mother new clothes, and they have been missing for a long time, haven't been found. Another family member expressed her concerns that her mother was prone to aspiration, and she was horrified to come in one day and see that an aide was feeding her mother in a reclined position without her dentures in, and on another occasion was left in bed for 6 hours lying in her own urine. We had one resident that came in after April 15th and I guess was demanded that his sons remove him from the facility and take him home. He claimed that a male orderly had thrown him in bed and left him uncovered and unclothed. And this resident's family had a great concern over a 40-pound weight loss that took place in a month and a half. And he had also was not being toileted, so had soiled himself. So I'd like to say at this time, for the sake of everyone involved, we do have a desire to see a resolution to all of this. And all of us dedicated caregivers have formed bonds with these family members and the residents. So it is extremely disheartening to see all of this happening, to say the least. And I think we all feel family members should be able to relax knowing that professionals are there to provide the needed care to their loved ones. And overall, these family members and residents should be able to depend on reliable and highly qualified workers. And these workers should be valued, recognized, and greatly appreciated instead of being devalued and at risk of being terminated because you have tenure and what have you. So we do ask for help to put a speedy conclusion to this situation that we are all in, because someday we might be there. So again, thank you for the opportunity.
Thank you for your testimony, and I ask you to please make sure that you give us any type of documentation or anything so that we can go forward. And thank you for being committed to caring for people in their fragile states. So thank you very much. Any questions or comments? Thank you, and have a good day. Emmeline Hodge, I think it's Hodgson or Hudson. Good afternoon.
Good afternoon. My name is Emmeline Hutchison. I am a CNA at Birmingham Healthcare Facility in Derby. A resident came out to the picket line one day to visit us. Her face was not washed. I saw dry peeling skin coming out of her ears. Her hair was dirty and not combed. She told me she had drunk soap one morning. She said a CNA had put a glass on her tray. She thought it was apple juice, but when she drank it, it was soap. But when she drank it, I'm sorry, I'm repeating myself. The resident told me that when she reported it to the director of nurses, she laughed. She comes and visits us on the picket line often. She also said that her phone call was broken, and when she told us it had been 6 days already. That makes me sad. I know that resident well. She is so beautiful. It hurts me to see her looking like that.
Thank you for your testimony. How long have you worked at the facility?
4 years.
4 years?
Mm-hmm.
Were you at another facility before that?
Before that, I used to work at Marshall Lane, and then at one time I worked in senior citizen daycare.
At Marshall Lane, were you a CNA also there? Comparable facility?
It's okay. It's like a assisted living. But I don't say it was the best facility in the world because I felt that it's private owned too, and private owners have a tendency of doing what they want to do.
Cutting costs.
Yeah, cutting costs. So treating the residents, not too good. You know what I'm saying? Getting, I don't know how to explain it.
You're doing good.
Huh?
You're doing good.
Okay. I feel like the residents don't have much of a say. You know, like, they supposed to have so much rights, you know what I'm saying? But the residents don't have, like...
Representation?
Representation. They sort of like dominate them a little bit, you know, when it comes to certain things, you know? Or they tell them they're going to put them out of there if they don't do what they say, you know?
Do many of the residents have family members that visit them, or are a lot of them there alone?
A lot of, you talking about at Birmingham?
Yeah.
I have seen more family members since we was on strike than I ever seen before. I didn't even know some of these people had sons. Some of them had daughters, you know? Because I never seen them visit so much, you know? But since we was on strike, a lot of family members been coming in twice a day. Like one lady started taking her mother out every day. She comes and get her every day now since we was on strike. You know? She won't let her stay in there, and then she brings her back at night. Because there was an incident where she went in there to take her mother out. Her mother didn't have on no underwear. She didn't have on no bra. She just had her outfit put on top of her body, you know?
So obviously the the families of the patients in the nursing facility are seeing a problem, and
Yes.
it is diminished. I wish the family members would start to contact us. I think that would be really important for us to hear from them also, because they, as well as you, can document and testify to some of the errors and the problems that are going on in the facilities. It helps us in shaping the discussion and the argument on how we do it. But I think Connecticut has to figure out, what do we want to do in nursing homes, and are we committed to providing twilight care as a clean and safe environment, as opposed to just housing people before they die. And that's what it seems like we're doing in many of the cases. Thank you for your testimony. Anybody else? Representative Gentile.
Thank you. Emmeline, thank you for coming to Hartford today, and thank you for your service to our elderly. You know, the one thing that struck me in your testimony is the only positive thing that we've heard today, and that is that since the strike has occurred, that you're seeing family members visiting their loved ones, and that's the only thing positive that we've heard today. Having said that, you said this woman visited you on the picket line. Are there other patients, other residents that come to visit you, and are they telling you same types of stories? Can you give me more information about that?
We had another guy that came to visit, but sometimes the residents don't always talk to me. They talk to other aides or something like that on the picket line. They'll complain or say they want us back in there and stuff like that. Of when are we going to come back? They ask us questions like that, or they tell us that they miss us and that they love us and they hug us and all that stuff. You know, a lot of them, I don't know whether they're scared to complain. You know what I'm saying? Because most of the time when we get a complaint, we try to, if a resident is capable of taking care of herself or capable of signing a paper, we get them to sign it. You know, but you can't. Like, if they can, a lot of them they figure that they don't have nowhere else to go to tell this stuff to. They can't tell it to the people that's inside. Are they scared that maybe an aide or something, or a nurse or something will retaliate? I can't say retaliate.
Retaliate.
Yeah, retaliate, you know. So a lot of them are afraid, you know, to say something.
Okay, well, I would urge you and the others that if you do speak with family members, and you see family members coming in and out, to urge them to also document what they are finding, because it would be very helpful to us.
Yeah, but
and again, thank you.
Yeah, thank you.
Thank you. Any other questions or comments? Okay. Next, Steve Karp from NASW. Emmeline, you did a great job.
Hi, I'm Steve Karp, Executive Director of National Association of Social Workers. I know that obviously the impetus of this hearing was really more spectrum than the strike, but I think it would be remiss of us if we didn't talk for a couple of minutes on record about the dismal state and dire conditions of social work and nursing homes. If you can imagine if you were told that you could only use 30-year-old computers to do your legislative work, think how difficult that would be. We're working with 30-year-old regulations for social work. Our regulations for social work on ratios say that you only need one social worker for 40 hours for every 120 beds. Let me just give you a very quick idea of what social workers do, and this is a small taste of their responsibilities. Amongst their multiple responsibilities are prompt referral for patients and families in financial need, helping each patient to adjust to the social and emotional needs to nursing home placement, developing plans of care for social and emotional needs of the resident, counseling residents and family members, discharge planning, coordinating care of outside services, dealing with issues of conservatorship, protecting rights of patients, assessing cognitive and mental functioning, dealing with resident-to-resident altercations, providing emotional support for residents coping with a loss of independence and function, and staff training. On top of that, let's add the paperwork. First of all, you have MDS, minimum data set, which is incredibly difficult, and coming October will be much more difficult and will take much more time from our folks. You have Medicare requirements for every 5, 14, 30, 60, and 90 days. We have for Medicaid, they have now gone to an outside contractor that's requiring clinical evaluations that have to be filled out by the social worker. By the time we do all the paperwork, and our folks are drowning in paperwork, we have realized that what really happens is that the social worker has about 11 minutes per week per resident for direct care, and that's for responsibility primarily for social and mental and social health of the resident. Clearly, the current ratio of one social worker to 120 beds, the ratio is absurd, it's outdated, it's undoable, and quite frankly, it's downright nuts. And as I said, come October, things will get worse. The other problem beyond the ratios have to do with who can be a social worker in a nursing home. The regulations are very unclear. They do allow something called an associate degree in social work or other related field. Number one, there is no such thing as an associate degree in social work, so it's interesting that we have state regs with non-existent degrees. Beyond that, clearly, most homes have one or at best two social workers, and to have people who do not even have a social work degree and then be able to expect them to meet the emotional and social needs of the residents is truly just undoable, and clearly it's wrong. I know you've heard a lot today, and you'll hear a lot more today about the physical health care. We want to make sure you keep in mind also the emotional and social health care that our social workers are responsible for. And finally, I will just say that the regulations allow for consultants. These are master social workers who will go in and consult if the social worker does not have a degree in social work. Years ago, I recall, I could be wrong, but I do recall years ago that was about 8 hours a month. The regulations now say quarterly. Quarterly. No hours attached. So you can have a consultant come in, I don't know, maybe an hour every quarter, meet with a non-social worker, and that meets the regulations. So clearly we need much stronger regulations for social workers. And we have attached recommendations as to what we believe are appropriate ratios, as well as what we believe are appropriate educational requirements. And we appreciate your opportunity and the time for us to share this with this hearing, and we also appreciate your holding this hearing on this important issue today. Thank you.
Thank you, Steve. Thanks for testifying for social workers. The change, has there been a change, or has this just been in statute and stayed that way for quite some time?
It's 25 or 30 years since we have changed the regulations for social workers in public health code. So this has been an ongoing problem. As I said, what's happening is you're seeing patients that are much more acute in care needs, have much higher mental health needs than previously, and the paperwork is just drowning our people.
Yeah.
So, whether these regulations met the needs 30 years ago, I honestly don't know. I can tell you, though, that to not change regs and not to recognize the difference in the reality that's current, it's just, it's wrong and it needs to be changed.
Thank you. Any questions or comments? Social workers, unite. Thank you. Thank you for your testimony. This is the end of our list of signed up people for public health. Is there anybody else who would like to testify today? Please come forward and state your name.
Good afternoon. My name's Lou Carter, and I would like to testify to the injuries rates, I worked for Stanley Steel in New Britain for like 25 years. I was injured there 3 times. Since Spectrum took over the home, Park Place, where I work, I've been injured 3 times in about the 4 or 5 years. So I just wanted to, state that, because I know I'm not the only one being injured. They have a place on where they send us when we're injured, and they send us to MedWorks. It's in Newington, And when I went there, I seen like 5 other people from the same place where I work, Park Place, there, So there are a lot of injuries, And that's all I want to say.
Could you spell your last name? C-O-T-T-E-R?
No, it's C-A-R-T-E-R.
C-A-R-T-E-R. Okay. So when you were at the medical facility, you saw other employees from Spectrum there?
Yeah, at least 5.
At least
same
5.
Day.
Do you have any idea what their injuries were?
I believe it was their backs, their shoulders. Mine was my elbow 2 times. I've had an operation on it. And it's they push us and push us. They lay people off, and they want more.
Are you full-time or part-time, sir?
I'm full-time.
Do you have any forced additional overtime hours?
No, they don't want overtime. They don't want to give us overtime. They want to push us during the 40 hours that we're there.
Okay. All right. Thank you for your testimony. Any questions? Yes, Representative Gonzalez.
Thank you for coming. Are you not afraid that it's going to be retaliation if you have to go back to your job?
No, because I have a union, so I'm not.
That's a good answer, especially for 11.99. Yeah. That's a very good answer. I don't know. Now that you guys say, well, that you know that the union is, is going to be behind you 100%. I heard rumors when I went to the picket line, and one of the things that I was shocked when I heard that there were some patients saying that when they complain, the workers, they were like kind of hitting them or kind of smashing them, and you never heard that before?
No.
Because that's what I heard. I heard that there were some patients that were complaining because food was not on time, food was cold, and they were not taking a shower. And the employees that they are hiring, and I don't have nothing against, other than crossing a picket line, but that they were like kind of, they complained because nobody's seeing them. They were pushing them and doing things to the seniors, and some of the seniors, they are afraid, and that's why I know that they are not going to complain because of that. And I will ask, I know that you guys are out, but please, I will ask, if you guys heard something about it, please take note. And I live in the same street, that's my district. And I'm very concerned and very disappointed because I help them to recruit seniors. And maybe some of those seniors, they're going through problems there. Maybe there are seniors that I recommend to go there. And I will ask, please, if you heard anything that they are treating, that way the patient, let us know, please. Yes. When we go to the picket line, let us know. Because I think that now that they are not providing the care that they need, but abusing them in that way, like, pushing them or hitting them, then I'll say I will go crazy on that because that's not acceptable.
Right.
Thank you.
Thank you.
Thank you for your testimony, sir. Anybody else would like to come and testify in the public hearing? And ma'am, after this young lady, come on, right up in front. Please state your name, please.
Hi, I'm Rosemary Kalazewski. I work for Hilltop in Ansonia. I've been there for 13 years now. One of my serious concerns is I was hearing this gentleman from the social work talk about the dementia and how difficult it is. And one of the things that I expressed was I had a lot of residents with dementia. And sometimes it takes as long as a month to get them to trust you in the little things in life. And at Hilltop right now, they're with strangers. And that they're not just with strangers. From what I'm seeing, they're getting new people. They're not keeping the staff. It's like a revolving door. And I can't even imagine the anxiety that my residents are feeling. That's a serious concern for me. And also the health risks. Because even with our own staff, when we're in there and we get someone from maybe agency and they didn't look at the charts all the way, because we have a booklet to look through, and you go in and you see that somebody with aspiration is being fed or the bed is laid down flat, that person could die. And these are some of the things that I think about. And since I've been on the picket line, there was a day that the generators went off. And I started having an anxiety attack because do these people know that they have to hurry up and go around and put the oxygen into the red things so that these people are breathing? Because not for nothing, some of the people that are in there today are certified, yes, but they're brand new in the field. It makes a big difference. You can't possibly be aware of all these things when you haven't experienced them. I've been in aid 35 years. I've been in aid there for 13. I was at Birmingham prior to that. It's all I've ever done. It's what I love to do. And for me, these become my family, each and every one of them, in one way or another. And it's just sad. And as far as being concerned about retaliation and all of that, I believe it's all in doing what's right for our people. It's not about that for me. And God will take care of it in the end. But, you know, it just takes such a long time. In the meantime, people are dying. And that's just all I have to say.
Thank you for doing what you do as a profession, because that is a very hard profession. I think all of the people here in the public hearing today, we all appreciate how hard it is to work with a population that's so dependent upon care and compassion from somebody else, and that's so hard. Thank you. Any comments or questions? Thank you, ma'am, for your testimony.
Thank you.
Yes. Anybody else? Good afternoon.
Good afternoon.
Your name, please, ma'am?
Prudence Peterson.
Thank you for testifying.
I've been a CNA at Laurel Hill for 24 years. I started years ago when I was 16 years old. I worked my last 2 years of high school on third shift, full-time, finished. And I've done, I came back, I tried other things and I came back into the field. And I've been at, it was Highland Acres, now Laurel Hill, for 24 years. There's been a big change. We are, for the most part, their family for our residents. They do get to know us, they depend on us, and for the number of years I've been there, they do depend on you. For loved ones that can't get there, loved ones that die off, they talk to you, they love you, they depend on your care. What I see going into that building now, I'm scared for my residents. And I miss them. We've had a couple come out and talk to us, tell us about the condition. It's pretty scary. These people try to run us over in our picket line. They swear at us. They spit on us. It scares me that these people are in there trying to take care of our people. Speaking of the service for Bob in our building, we asked that we could go in at least to the service for this gentleman, and basically we were laughed at and said no. We were on a picket line. We had a nurse come out and say, we want you to be quiet for this service, which we had planned on doing anyway, out of respect for Bob. And we're kind of surprised at some of the attitude for the people that we've worked with. Because we chose to do this for things that are right in our building. We need right. I guess that's about it.
Thank you for your passionate testimony and standing up for the care. Any comments or questions? We can tell this is hard. And how long were you there? 13 years?
No, I've been there 24 years.
24 years?
Yes. I'm now 63.
Wow.
And I worked my last 2 years of high school, and I more or less decided, tried other things, and I love the field. I love the people. It's very difficult. They make it very, this spectrum, you want to talk about retaliation. If they blame us for things that are not our fault, they cut our staff. These people now, they have dementia. We don't get the training for them. We never had people like that before. They sent them out if they were abusive, if they didn't understand or they have the dementia. Sure, we had Dick Steen come in a couple times and give us a short in-service, but we need more than that, and we don't get that. All we get is, well, you have to talk to them differently, or you have to do this, we're trying. We do our best for those of us that have been here a long time. And that's how you learn, and they need this. We need the training also, which we don't get. We don't get the in-services we need. And then they blame us if we don't know something. I found this in the last few years also, among others.
Thank you for your testimony, and thank you for doing what you do.
Thank you.
Have a good day. Thanks. Anybody else? Come on down.
My name is Cynthia Bednar. I've worked for Hilltop Health Center in Ansonia for 14 and a half years, and we too have family members coming out to our line, actually crying. I've had to reach through an open window and tell them, oh, first you have to pull past the yellow line because, God forbid, our toes go over, we get arrested for trespassing. And her family member, I don't want to say a name because I don't have permission to say it, has been dropped twice since we've left, since we've been out on strike. He was sent to the hospital. She came to visit him the other day. Didn't even know the man was in the hospital. Nobody notified her. She was in tears crying because she didn't know what was going on with her loved one. The man has since come back, now has an infection where they have to use protective gear to go in and see her loved one. We had another family member bring her loved one to the line, who is supposed to wear a seatbelt and a knee buddy. I don't know if you folks know what that is, but it goes in the knee and it's in between the knees and it's locked in place so that the patient can't fall out of the wheelchair or slide out. Also wear a seatbelt. It was around his ankles. No seatbelt on. His wife has to come up an incline to bring him to us. If she went back down that line like that, he could have fell out of that chair because it's a steep incline. We took it upon ourselves to fix his seatbelt, to fix his knee buddy, because we care about them. Those are our people, our patients. We love them. It's human life. It's not a joke, and Spectrum doesn't get it. And I just wanted you to know these are some of the things that are going on there. We love those patients. We know their quirks. We know their, every little thing that has to be done with them. Who's a pureed diet? Who's a chopped diet? Who's a regular diet? Who needs thicket? What type of thicket at that? There are even nurses on board. The nurses they have coming in, who will come in and give Mrs. Jones a glass of water to take her pills with. We have to remind them, do you know she's pudding thick? Do you know she's nectar thick? Even nurses forget. So what are these new hires going to do? All they do is taunt us and say, we have your jobs. Well, you might have our jobs now, but we have our patients back. That's why we're out there on the streets fighting for them. It's not just for us, it's for them.
Thank you, and thank you for your testimony. Thank you for coming, stepping forward. I know that was hard.
Thank you.
Representative Terziak. Wait, come back.
Oh, that may be okay.
That's okay.
Still get that seat. Okay.
I've had that effect on women before.
I'm sorry.
Thank you very much for coming here. And when you mentioned that's why we're on strike, that's why we're out there, I was thinking that I'm a nurse myself. I've worked in a convalescent home. It's the hardest job I've ever done.
It certainly is.
And all I could say was, thank God I'm not one of the CNAs. When you folks go on strike together, there's an opportunity for things to really change for the patients for the better as part of the process of reaching resolution. Usually, the strike is caused by people not wanting to work together to make things better for the patients. I find that better than what we used to call going on strike one at a time. When you can't stand it anymore, you quit, and nothing ever changes. The turnover's higher, the patients are treated by strangers. In for-profit convalescent homes, it's tough to make money. But I was struck by the place I worked where, just as an aside, in orientation, I really remember one part. Here's how to do a tube feeding. You know, it's useful to be reminded. It's been a while. Show a 50 cc large syringe, and you fill it up, and you use the plunger, and you push it in. Second half of the lesson. If the state is here, you use the same syringe, but it's a gravity feed. It's wrong to push it in. It's bad for the patients. Now, that wasn't one of the convalescent homes where you guys are fighting. That was a convalescent home where the workers got fed up, joined 1199, and worked to change things eventually. We've got a real problem going on here, and these homes may be worse than others, but by the same token, because you guys are on strike, your patients have a chance, when you win, to have things better. Better staffing, better pay means less turnover. Your staff's there long enough to fall in love with you and want to stay. You know, that's the kind of stuff you're talking about. So thank you very much, and thank the rest of the strikers, too.
Thank you.
It's making a difference for the industry and the patients who are cared there. Thank you. Thank you, Madam Chair.
Very much.
Thank you. Thank you for your testimony.
Thank you.
And we will work on this very vigilantly. Thank you.
I appreciate it.
Anybody else that would like to testify? Oh, now everybody's going to say.
Hi.
Hi, would you state your name, please?
Linda Galinsky.
Say that again, please.
Linda Galinsky. I hold a few different titles at Laurel Hill Healthcare. I've been a CNA there for 10 years. I started out in housekeeping laundry, so a total of 16 and a half years. And as the lady behind me, I feel guilty for bringing my grandmother there. I'm her power of attorney. Excuse me, it's just very sentimental. I flew her over 1,000 miles because I knew the type of care she would get. And since the day she's been on strike, we've been on strike, I had gone in and I seen my grandmother at the desk crying her heart out. I walked in and I asked her what was wrong. She had told me, these people in here are mean to me. So I tried to calm her down, my mom and I. It wasn't easy. She had no shoes on, no hearing aids in. She looked really dirty and smelled. Her bed wasn't made. Her roommate's bed wasn't made. It was dirty diapers on the floor in her room. And I contacted the state. I have gotten repercussions from the administrator. I have been threatened that she would take my rights away. I actually have the papers. My grandmother has lost 30 pounds. My daughter goes to see my grandmother, but because she's on the picket line, she gets dirty looks. I have given my union pictures of my grandmother, the way they had taken her out to a doctor's appointment. She looked disgusting. I walked in and I said, "Oh my God, this is how my grandmother is going out?" I told the social worker, I told the nurse. I redressed her, did her hair, took a total of 10 minutes. And the state ombudsman walked in and she says, "Oh, you look very nice, Eunice, today." And I thanked her. I said, "Thank you." And she says, "Wasn't she ready?" I said, "Yes, she was ready." I said, "I'll show you the pictures I just took of her 5 minutes ago." She couldn't believe what she looked like. I said, "And they took my grandmother out in public like that." I said, "My colleagues here would never do that. She had somebody else's clothes on. Because of the weight gain loss, I had to go out and buy her all new clothes, and I've asked them to please, if the clothes are too big, return them to me. Do not put them on her. I don't care how much money I have to spend on my grandmother. That is my grandmother. It's my only grandmother left. And I feel guilty for bringing her that far. And she's being treated the way she is. She tells me on a daily basis how scared she is. You know, my friend, which was her caregiver, she asks about her. I don't dare bring her in, because if I do, I'm afraid they'll arrest her for going in, crossing the line. A couple weeks ago, I went up to see my grandmother, spot checked, and they had this girl come out of the kitchen. She had tattoos all up her arms, all up her neck. She had big gauges in her ears, and I was a little bit scared by that. And now, could you imagine what my 83-year-old grandmother said when she seen that? She was frightened. On another occasion, she told me how that one little girl came in and demanded that she goes to bed at 3:30 in the afternoon. My grandmother told her, "Okay." She went back out. My grandmother says to me, "Well, I surprised her. I really fooled her." I says, "What did you do, Nana?" She says, "I put my pajamas on and got under the covers so she didn't know I really had my pajamas on." I addressed it with the social worker. They have done nothing about it. I told them that her normal caregiver that she has now in there, I'm not happy with. She has a beard constantly. She has 2 electric razors. That is a dignity issue. And to me, I want to take her out, but I'm afraid if I do, she'll pass away because of the change. But as soon as they found out I was going to take her out, they were right there. "Oh, you don't want to take her out." So I'm kind of stuck between a rock and a hard place.
Thank you for your testimony. I know this has got to be a horrible dilemma to be in. Representative Gonzalez.
Where is the facility?
Laurel Hill Healthcare.
Where?
Laurel Hill Healthcare in Winston.
Oh, Winston. And what's your grandmother's name?
My grandmother's name is Eunice Vallejo.
Eunice Vallejo.
Mm-hmm.
I got a question, Madam Chair. Us as elected officials, can we go and visit these facilities when they are on strike? Huh? So we're not able to go?
They are private property. We are subject to their visitation requirements.
And what about if we know a person, like we got a friend there, and we decide that we're going to visit our friend? Can we do that, or still?
It's up to the facility and the families to determine whether you can visit them or not.
Can a family member press charges? But maybe there's another way to go. They have to learn. You know, they are there to do their job, not to mistreat people. And I think that I think we should find out if they can press charges against the facility.
I think you also have to be very careful about what you do because you don't want to put any one single person in jeopardy. So you have to be very careful how you make your steps into the facility and to whom. But I understand your compassion in wanting to give this woman comfort to know that somebody else is visiting her grandmother. But I think we need to talk about that, okay? Thank you. Thank you for your testimony. With that, I will conclude the public hearing, and I thank everybody for coming. Have a good day.